everybody. I am Lisa Poff, and I'm project coordinator with the Indiana Deafblind Services Project. And I want to welcome you to this afternoon's virtual workshop, Family Matrix Planning with Olaya Landa Villayard. I think at this point in time, I'll pass it over to Olaya so we can get moving.
All right. Thank you so much, Lisa. Hi, everyone. Thank you for your patience. Thanks for joining us today. We have about six people to work with, which is good. You know, I'm happy. I'd be happy if it was just one. So we're good to go with six, because then you can take this information and pass it along. And of course, it's going to be recorded. But so that's another plus to this. I'll give you a quick little bit of background on myself. My name is Olaya, and I've been in education for well over 20 years, like early intervention to 22. So I've got kind of like a really big span of experience. However, my favorite area to serve is early intervention. I am bilingual, and so my bilingual skills really came in really help. I mean, just amazingly helpful when I was in Houston, Texas. In Houston, I was the educational diagnostician for the program for students with visual impairments. And so what an educational diagnostician is a person who is almost like an LSS or school psychologist, excuse me, we call them LSSPs and you might too, but the school psychologist. And the big difference between an educational diagnostician and school psychologist is an educational diagnostician, one, has to have had at least 3 years of experience in the classroom. And we also are not licensed to perform behavioral assessments to determine eligibility for like autism or emotional disturbance. However, we do work closely with the school psychologist when it comes to working with those types of cases. But we had about 300 students in the program for students with visual impairments. And so that was my caseload to make sure all of those students received their initial evaluations, their triennial evaluations, and any other types of special evaluations that were requested. And I also ran the early intervention, early childhood child find center where we had arena assessments that were conducted. So I have a lot of that type of background in assessments. I carried a caseload over the summers, so I would go into the homes and do early intervention, but I also would work with kids and with IEPs in the schools, just depending on what came my way and whose cases I was covering over the summer. So that's a little bit of, oh, and one last thing. I was a professor at Illinois State University for about 5 years, but I'm now the director of the American Printing House for the Blind Connect Center web programs. And so the Connect Center is made up of Family Connect, Vision Aware, and Career Connect. And so if you ever get a chance to visit our websites, you may find a lot of good information for families and to help you help your families on the familyconnect.org website. So I wanted to mention that as well. So with that said, I will get going on what we're going to be talking about today, which is the family-centered early intervention practices, matrix session planning. So this matrix session planning, this idea came about during some courses that we were at Illinois State University teaching based on a grant that we wrote that was specific to early intervention. And so our early intervention grant was training teachers of students with visual impairments, training them to become early interventionists, training them to become developmental therapists for vision. And then we also had developmental therapists for O&M. In Illinois, you have to have a specific type of certification in order to practice early intervention. It's not through the school district, where when I came from Texas, from Houston, early intervention was tied in through the school district. And so our VI teachers, and myself included, we would provide services to students in the home in early intervention based out of the school in which that student would end up attending once they transition from early intervention to early childhood. So that's how, so it was a big learning curve actually coming into Illinois, seeing how that, how it's set up here. So the grant helped us increase the number of developmental therapists for vision and O&M. We were able to double it. So we went from 22 to basically 44, 46, somewhere around there. And that doesn't sound like a whole lot, but I mean, it was better than what we had before. The 22 that we had, most of them were up in the Chicagoland area. So I always used to joke, well, that means that anybody that's not in Chicagoland, you know, South, you know, none of them, we don't have any blind babies outside of Chicago, basically, but we definitely do. And so that grant helped us put some more out there, but Illinois is still very much in need of more credentialed developmental therapists for vision. So hopefully this will help you as it came out of that early intervention grant. And I will also later on in the presentation show you a website where you can go that was created as part of the grant that has a lot of information about early intervention and activities and research, all those different types of things that we all need and we look for to be able to justify the types of practices that we're implementing with our families. So the matrix session planning, it based on the article that was written by Mindy Ely. She was one of the coordinators for the grant, and she had two of our students who were taking courses write the article with her. So it was really cool to have a publication in the Journal of Visual Impairment and Blindness come out of our grant with our coordinator and two of our actual students who helped develop this. So really excited about that. Let me make sure this is, okay, there we go. So we know family-centered intervention is different from teacher-centered, teacher-directed instruction, which for some families, and for some practitioners, it can be a little difficult if they're used to maybe the medical model, especially for families in early intervention, where the occupational therapist comes in, or the physical therapist, or the speech therapist comes in, and it's more of a medical model where the therapist is actually working with the student more so than teaching the parent how to work with the student, right? Where for us, we're very family centered. We are there maybe once a week, maybe once a month. I know right now during COVID, it's a little difficult because of the safety measures that we have in place. I have a friend who works for VIPS there in Indiana, and I know one of the things that he was telling me that like some of the kids they're only able to see them once a month. And so really, if we are not teaching the families how to work with their children, that once a month of just going and consult is not going to obviously move our kids in progress towards where we need them to go and meeting those outcomes, right? So definitely differs from from that teacher directed instruction. And also because the teacher directed approach assumes that we're the experts, which yes, we bring the training and the knowledge with us, but really the parent is the expert in their own child, right? They know their kiddo way better than any of us ever would. So it's important that we are more of a team than us being the expert coming and telling the parent what to do and how to do it. We want to coach and collaborate with them. That's really the most important part. Of course, with this family-centered practice, the family determines the direction and focus for the intervention session. So we always have to make sure that that's why it's called an IFSP, right? An individual family service plan, because it's based on the needs of the family, not necessarily what we want the family to do or where we think the child needs to go. However, that's where the collaboration piece comes in. Just because it is family directed and family centered doesn't mean that we can't collaborate with that family to make sure that the goals and what they are looking for to work with their child, that it's developmentally appropriate, and it's falling in line with those developmental milestones. You know, we can't ask the child to start walking before they can crawl, or some of the precursors to walking need to take place. So that is something that that's where that collaboration piece comes in. And then the coaching, once you've collaborated and come to an agreement, and the family wants that, that's where we go in and we do our coaching to help show them how to maintain this while we're not there. Again, family-centered early intervention allows parents to guide their child's development. It honors their family's culture and values. And sometimes that can be tough because, you know, I'm bilingual, I'm Puerto Rican Mexican, and, you know, we have different ideas about, you know, a child with a disability may be treated differently than a child without a disability, where a child with, I know I'm speaking from experience, my brother was born, he weighed less than a pound. And so, you know, he had some intellectual disability, social emotional disability issues. And, you know, he was babied, I mean, just up until, unfortunately, he passed away a couple of years ago. But up until the day he died, I mean, he was like, you know, our special baby, right? So but being a special educator, I knew better, and I knew to push him and force him. But we have to take that into consideration when we're working with the family's culture and what they're expecting from their child. And it can be an issue when in early intervention, especially when we're working not only with the child, but then the family dynamics in the home, who's in charge of the decisions that are being made. And so, you know, we have to be clear on that, and be respectful of that, and the value structure that they have set up there. And of course, parents working directly with their child, you know, strengthening that parent-child relationship. I've heard stories, and I've been involved in experiences this way, where, you know, the parent sometimes gets upset that, like, they can't go off to the kitchen and wash dishes while you're there to work with the child. And because again, we're not the medical model, we're the coaching and collaboration model. And so, you know, trying to be clear about that service and how we provide that service upfront is very important, so that they understand the big differences between your early interventionist from the education side versus the medical side. And that can sometimes be confusing. And of course, it supports the parent and child communication. So this planning method was based on planning and delivery models that are described and recognized in resources, recognized resources in the field of visual impairment. So we have there is like a parent curriculum that APH has. There's also Dr. Chen and Dodi Kwan have a book on early intervention and visual impairment, and Peterson and Nielsen, they have also some articles about how to plan your lessons, and how to guide and collaborate with your parents on what the skills are that we're trying to help our infant or toddler move along on that developmental scale. So what is this matrix session planning, right? What is all this stuff? I keep talking about matrix and all these other all these other things. So basically, it's a way to plan how your goals for what you're going to work on with the family, which we already do. And we do that on the IFSP, but in a lot of ways, those IFSP forms and all this handwriting and all this other stuff can be overwhelming for a parent. Whereas on this matrix, it's basically a table or a chart where you are putting the skills that you would like, that the parent would like, and you would like for the parent to continue to work on in your absence. For their different times of the day and their different routines. So like maybe during playtime, maybe during lunchtime, maybe during bath time. And so it's divided out into those sections. And then you're looking at what the child is doing during those times, and what we would like for that child to be doing during those times. And then how do we get the child to do those things? How do we get the parent to work with the child to get them to do those things, okay? So it focuses on the family priorities, their routines, and identifies those strategies that tap into the child's strengths and needs, okay? And one of the things I wanna show you, okay, good, it's live. This eiviprofessionals.com, you can find more information about the matrix session planning here at this website. So the website is EIVI Professionals, and I just have it linked directly to this session planning matrix information. And of course here you can see there's a link to the planning matrix form, which I'm gonna show you in a few more slides, and then we're gonna read a case study. It's a short case study. We'll read it since there's only 6, 7 of us. We'll read it and think about some of the behaviors that stand out and talk about maybe some of the strategies that we may want to work with the family and work with the parent or guardian, work with them on how to work with their child during that particular when they are displaying this particular behavior, okay? And so I wanted to make sure that you were able to go to this website and you can see all the information that's here. So just for an example, a matrix here would be like when they're outdoors, that may be a part, whatever during the day, that routine when they're outdoors, during playtime and during dressing. You know, the parent is looking, we want the child to have confidence walking with texture and surface changes. So that's like an O&M issue possibly. So when they're outdoors, one of the ideas that we can share with the family is using a push toy, like a grocery cart or one of those popping push toys, or even a hula hoop that the child can hold and push in front of them to help them preview that path. And so they're not special materials that would cost an arm and a leg. These are materials that are common to many households who have little children. And if you're like, if, you know, in my experience, I've worked with families who don't have access to push toys or grocery carts or any of those things. And so then that becomes an issue of, okay, let's maybe tapping into some quota funds from the American Printing House for the Blind. You do, as an early intervention provider, have access to those quota funds. And the quota funds are used to purchase materials from the American Printing House for the Blind that you can use in your early intervention setting. And so if you need more information on that, you could find, I guess the way you find out is you have to find out who your ex officio trustee is for your region or for your area. I'm just most familiar with Leslie Durst out of the School for the Blind, but I'm not sure how else Indiana is broken up as far as ex officio trustees. But just know that as early intervention providers, you do have access to those funds, okay? And so anyway, I'll go back to the example. So looking at, this is one strategy that we could recommend to help the parent with helping their child have confidence with texture and surface changes. During playtime, they can use that push toy again, moving about, practice bumping into obstacles and then moving around it. So, I mean, sometimes these things sound like so common sense, like why do we even have to, you know, sit down and actually write this down? But it's common sense for us because we are educators and we know about developmental levels, and we know about, you know, developmentally appropriate practice and skills. And, you know, a lot of this goes back to Piaget. So knowing Piaget, going back to when we learned about those stages of development, you know, we have to make these things very literal and written out for the families. It helps them, gives them confidence and empowers them to know that they can have this this ability to help their own child. We always have to remember, you know, this is somebody's baby that really didn't expect to be born with a disability. And so, we're dealing with people who are out of their comfort zone sometimes, with their children, and they love their kids and they want to help them, but they don't know how because they weren't, they may not be TVIs, they may not be early interventionists. So that's why it has to be so laid out and written, and having it in a table form, it makes it so easy for a parent to stick this on their refrigerator with magnets, and they have their plan, basically their lesson plan on what they're going to be doing and how they need to do it, without having to pull out their notebook with the IFSP in there that has the goals and all this other stuff, and it can get overwhelming. This is really and truly made to help make it less overwhelming for the family, and it's more doable this way. Okay. Oh, let me, so anyway, there's an example matrix here. And then of course we're going to do one as well, together in just a little while. But just so you are aware, there are different areas on this website where you can go: understanding development, topics of development, there's fact sheets, and research. Because what we're doing needs to be based on either practice-based research, or scientifically based research, evidence-based research, or needs to be based on promising practices. So promising practices it's a little different in that it's what we're doing with the kids. It's on an individual basis because all of our kids are very unique. And we have been doing this practice for so long that it appears to work for the kids who we're working with. But because our kids are so unique, it is very difficult for us to be able to prove or disprove if something works in a scientific manner using high level statistical type research and software. There's a whole lot of reasons behind that, but basically all of our kids are so unique that even if you have two kids who are sitting next to each other with, let's say, CVI, they both see very differently. Even though they have the same diagnosis, they're not seeing the same thing. Same thing with ROP. Two kids sitting next to each other, or even 10 kids, they all have ROP or all have CVI. Each one of them is going to have a different way of different visual function. And so that's what makes it difficult for us to norm a particular practice, because we just can't find 30 kids who we know have the same diagnosis and also see the very same way. I don't know how we'd ever really know whether or not they're all seeing the exact same way. And that would be difficult to measure, especially with little ones. I mean, how do you ask them, right? And how do they tell you? So, so I just want to let you know there's an EIVI toolbox. So there's intervention ideas. And there's also planning session information where you can go in and get some help on how you want to run a planning session. More information about EIVI professionals. It looks like they have cleared out the events, but you can also register for a login, and then you can have your own, you can be getting notices and things like that. So I think it's a really good resource to have. It's very unique in that we don't really have a lot of EIVI unique type sources to go to. So definitely wanted to point that out. Okay, so how do you plan with the matrix? Well, you interview the family, the parents, and the caregiver to learn about their concerns or priorities. And so there is a form, an interview form called a routines-based interview, and that's by McWilliam, Casey, and Sims. A lot of research has been done on that. It's not necessarily written just for the population of students who we work with, but it is for early intervention in general. And so the thing about the routines-based interview, it can take a few sessions for you to get through that particular interview process, but I think it's definitely worth going through it, even though it takes a few sessions, because you're really getting to know this family and really getting to know those routines and their needs. And you're also getting observational information if you're there. If it's taking you 2 or 3 times to get through the interview, that means that's 2 or 3 times that you're there in the home observing and seeing what's going on, because that also gives you really good information about what priorities the parents have, what you're seeing, like, well, maybe the priority, the parent has this priority. However, in order for us to get there, we have to maybe back it up and start in a different place. So it takes long, but it's really setting you up for, in the long run, to be able to be very effective in your intervention. And of course, this is what I was talking about from American Printing House, the parent assessment of needs from parents and their infants with visual impairments is the PAIVI. And there's an older version, the new version just came out in I say just came out, it was 4 years ago, 5 years ago, in 2015. And so in there's also interview forms that you can use to help guide your interview so that you know what to ask. Sometimes it can be difficult to know what to ask. You don't know what you don't know, so you don't know what to ask, especially if you're a newer early intervention provider. If you're real seasoned, you may feel more comfortable without having a form or format. However, it's always good, even if you're a seasoned early intervention provider, it's always a good idea to look at a research-based interview program that's not too old, and that way it can help guide you with maybe some questions you didn't think to ask before, because we want to get the fullest picture we can. So then we also have, second, you want to take those concerns and priorities and you want to enter them in that left-hand column, just kind of like what I showed you before. Go back to the website. Here we go. So you would take that and put it here on this left-hand column. So these are the priorities. The walking, using their fingers is a priority for this family. Dressing and undressing themselves, that's another priority for this family. And so you would gather those concerns and that information. Oops, there we go. Where's the... hold on, so you can see it better. So then, yeah, you put that in that left-hand column, and then of the matrix is one outcome or goal priority per row. So you saw how we had the three, and then we had the three columns that identified the routines that need to be listed across the top row of the matrix. So they had outdoor time, playtime, and I forget what the other one was. I'll pull that up. It was outdoors, playtime, and dressing. Okay, so you see how if we're outdoors and confidence, we've got that. Dressing and undressing self, apparently that's something that could be done outdoors, taking off their jacket and shoes with help as needed, and providing support from behind as needed. So if they need help with, buttoning or tying or using Velcro on their shoes, that kind of stuff. So that would be for outdoors. So you can see your goals are on this side and your routines are the columns, your goals are the rows. Okay, easy enough. I think it makes it, like I said, I think it makes it a lot more readable and less overwhelming for the families, which is what we need to be thinking about whenever we're doing any kind of intervention, is remember that they are a lot of times already very overwhelmed, especially if they have more than one child. And I know families who have multiple children with the same type of visual impairment because it was genetic. And so you've got families like that. And then you've got other families who have other typically developing children. And then you have a child with a disability. And one thing I want to point out real quickly is it's important that when we are making those distinctions between the children of a family that you are who you're providing intervention for, that we don't say, oh, you have other normal children and you have this one kid, your one child has a disability. Because you say normal, then that means their other child is abnormal, and that's not how we want to phrase things. We need to be very cognizant of that, and that's why I'm like, you have one who's typically developing children, and you've got one who's got atypical development. Eventually, I'm sure that will become kind of like go the way of the R word or the normal and abnormal. But for now, that to me is a less I don't want to say discriminatory, but a less harsh way of pointing out the differences between your typically developing children and your children with disabilities. Okay. Okay. Let's see. Okay, so we've already gone through how to plan the matrix. And then of course, the fourth, parent and provider then brainstorm solutions or strategies using the child's strengths, preferences, and adaptive needs. And then solutions or strategies are based on information from the interview and any assessment data that's available. So that's where that interview piece really is super important. We have to take the time to do that. I don't know how many of you have made that a big part of your practice during the interview. A lot of times, I know in my experience when I was in Houston, we had a social worker who was part of our early intervention assessment team, our play-based assessment team. And she was always the one who would get the families to like fill out an interview form or take the time to interview the family. And when I got there in that department, I made sure to be with her when she was doing that, because I felt it was important for me to get that background information myself and get to know the families, kind of break down those barriers. And otherwise, if you're not doing the interview yourself and getting that data, you're just getting information off what was written on a document, and you may miss something. So it's really important that you're getting that information to help with this fourth part of brainstorming solutions from the interview, and also assessment data. But always take that with a grain of salt, because a lot of assessment instruments are not particularly made for and geared toward our kiddos with visual impairments, deaf blindness, multiple disabilities. There are a few that I've used and I recommend and I like, because they have accommodations and allowable modifications that can be made for the assessment itself. So there's, of course, the Oregon Project for visually impaired preschoolers. And so that one I think is probably one of the most common. And it's a good assessment tool. It's not normed, it's very criterion based, but it doesn't go really low for our kiddos who have more significant needs, more significant disabilities. So for those kiddos, I want to be sure that we're able to tease out what they can do, which is always really important, at least in my practice, because these parents have been told what their children are not going to be able to do or will never be able to do. And I always tell my students who I teach, I still teach in adjunct, I teach at Indiana State and for San Francisco State. Online, obviously, because San Francisco would be nice to be there, but too far and too expensive. So I teach online, one class a semester. And I always tell them in so many ways, I find part of our job is to prove the doctors wrong. Not that they are not smart and capable and know what they're doing medically, but developmentally, I always leave that to us. That's our job, right? We're teachers. We're the ones who are trained to work with our kids and intervene and teach. So I think it's extremely important to keep that in mind when we're working with our kids. So we've done that with the, oh, that's what I forgot. Sorry about that. So beyond the Oregon Project, we have the Carolina Curriculum for Infants and Toddlers with Special Needs. So it is a curriculum. So it's a curriculum-based assessment. There are allowable accommodations or modifications that are recommended in that curriculum itself. And for the assessment booklet that is inside the curriculum. So the Carolina Curriculum for Infants and Toddlers with Special Needs, it's a small spiral bound book. And in the book, there is the the assessment protocol, the assessment booklet is in there, and you are allowed to make copies of that assessment booklet for, so that way you have a copy to use for each of your students, each of the kiddos who you're working with. And that particular booklet you can keep and use with one kid for 3 assessment cycles. Where if you're doing an assessment once a year, that'll last you 3 years. If you're doing an assessment once every 6 months, it all depends on the kid, right? Because kids change so quickly. And I know with IFSPs, you're meeting just about every 6 months. So that booklet can be used multiple times for the same child. And the questions or the skills that are being measured in that assessment booklet match up to a curriculum goal or skill within the book. So it makes it really easy for you to help, and the family to help with planning goals, and then how to reach those goals. Because then it gives you ideas for activities on how to help the child with reaching that goal. The same thing for the Oregon project. The skills that are listed in the Oregon project assessment part align within the actual curriculum, align with a skill or a goal within that curriculum. So in a lot of ways, it makes it a lot easier, takes out all the guesswork, because the way it's designed along the lines of those developmental levels that we have to get A before we get B, and so forth. So those are the 2 assessments that I recommend. In addition to that Carolina curriculum for infants and toddlers, there's actually one for preschoolers as well. So if you tend to like that one, because it goes low enough to really tease out the skills that our kiddos have that may be missed by the Oregon project, you can continue on with that into their early childhood programs, their preschool programs. Now, if you happen to have a kiddo who is really, really low, they're functioning, they just have very severe multiple impairments, we do have the insight. And I think, Lisa, there's training that is being offered by the Deafblind Project. Is it on Insight, or is it on it's one of the deaf blindness assessments? Is it Insight, Lisa? I don't know if she can hear me or not.
Sorry, it took me a minute to unmute.
No, that's okay. What is the training? It's not Insight, but it's
Insight is the deaf blind one through
Yes.
Sky High, and Visa is the visually impaired.
There you go. So that's the training. That particular assessment is for will be very useful for those kiddos who we really have to look at the severity of their impairments and be able to really tease out what they can do. Because working with the family, I don't want to go to them and say, your kid scored a 0 on this entire test. Like, I just can't do that, because every kid can do something. And we take that something and build off of it. And that's where this matrix planning can help us, and having that assessment information and data coming from those particular assessments that are geared towards kids with visual impairments, geared towards our kids with deaf blindness, geared towards our kiddos who may have multiple impairments. So just keeping that in mind will also help you when you're trying to plan the matrix, is having some data like that comes from an assessment that we can use to help guide us through this process, so that you're not guessing. And it also helps focus the parent down as well into what are some of the goals that they want to see or they want their child to reach. Because sometimes, again, they don't know what they don't know, so they're not going to know what to ask. In a lot of ways, this may be their first time they're ever dealing with a child that has this type of disability. So they don't know what they don't know, right? That's where we come in, and that's where like some of these assessment tools come in and help us, in addition to the interview, because we learn things about the family and about the child through that interview that they wouldn't think to tell us, okay? So looking at how these ideas are entered into the matrix. So again, we're looking at the parent concern or goal. So this parent wants to encourage the use of their vision to explore. And they also want to have their child improve their reach and grasp while looking. Again, remember, if we have a kid with CVI, this may be a little harder than what the parent might think, because they're trying to understand the visual impairment. However, that doesn't mean that we can't keep it as a goal, and maybe work through and find strategies that might help lead that child to improving their reach and grasp while they're looking. So, you have to remember, parents don't know a lot of the things that we know, so we have to coach them through that. So here, it looks like the routines they chose were like during snack time, bath time, and playtime. So, that's the important thing, right? With early intervention, we don't want the parents to have to go out of their way to be doing these activities to work with their child on helping them reach their goal. We want these things to happen in their daily routines, their everyday things that they do, because parents are already busy enough. So every kid has a snack time, right? That at least we hope they do, if they're lucky enough to have that snack time. So here, with encouraging the use of vision to explore for snack time, the suggestion was position the caretaker on the child's left and place the snacks on the child's left. So it will then make that child use their left field of vision to look for their snacks, right? Instead of us giving it to them, or feeding it to them. I've watched sometimes working with kiddos, especially kids with deaf blindness, who things are given to them and then taken away, and they have no idea, like, that stuff comes from somewhere. Like, if it's in a lunch line, like their food, they have to go get it, and somebody cooked it, and it didn't just all of a sudden appear on their table. And so that's part of what we're trying to do right here, make the child be able to look at their own snacks. They're able to do that on their own. Maybe during bath time, move a yellow duck across the water for tracking. You're already bathing the child. Might as well, take that time and encourage them to use their vision to explore. Search for high contrast items in that sink. For playtime, explore a variety of high contrast textures, blocks and balls, or play hide and seek with noise making toys. So these, you can see how these are the types of things the parents can have in their day when they're already in the middle of doing these types of things anyway. And so the matrix guide, the matrix table, makes it a lot less cumbersome. Okay, or at least I think so, and some of the parents who've used it think so as well. In that article, if you read it, you'll be able to see some of the parent reactions. So then, using the completed matrix, you can choose a strategy from the matrix to focus on during the intervention session. So the matrix is there, you've got maybe 2 or 3 goals, and you've got the activities, right? That doesn't mean that you're going to tell the parent, okay, I'm here, let's see how we can get this done, let's work together and we can show you how to do this. And then when I come back next week, we're going to work on the next goal. It doesn't have to be that way, because then it can be overwhelming. And because if the child hasn't met that first goal, they may not be ready for the next goal, right? And so you can choose which one you're going to focus on during your intervention sessions, and you can choose the length of time that you're going to be doing that one. There's no right or wrong way to do it. It all depends on the family. Since this is created by the family based on their priorities, they are more willing to join their child in trying these new ideas, because they are creating this. You're there kind of guiding them and coaching them, but it's all on them. I've been at IFSPs years ago, where the parent is sitting there and everybody around them is writing the IFSP, like, okay, we need to do this, but like the parent never once says anything. And I think we need to be real careful with that. With this matrix, they can write this themselves with you there, coaching them through this, collaborating with them. And so if they have buy-in, they're more likely to work on these things with their child while you are not there. And when you come back, then you will notice the difference. You'll notice that the child has improved. especially for progress monitoring, it's really important. I mean, you can even get the parent, help them make like a little, you know, something to check fidelity for us, a little chart that has like a smiley face when they did it, or a check mark that, that the child was able to do it. Something that helps with progress monitoring, but for us, but also helps the parent see that their child is making progress. So they don't think this is just some busy work that we're, trying to get them to do. It also helps the early intervention professional take on a coaching role, and demonstrate those specific strategies when necessary. So again, it helps us kind of step back and be more of that coach for the family, so that they are aware that we're there to help coach them through this. We're not the therapist that comes in and works with their child on physical therapy or occupational therapy or any of a bunch of therapies that our kids tend to get. We can keep the matrix small so as to not overwhelm the parent. So just because there are, 1, 2, 3, 4 rows doesn't mean that you have to have 4 goals and with all this, and then it can be overwhelming. You can choose 2 goals, depending on the child. You can choose 1 goal if they're really severely impacted by their disabilities. Maybe focusing on that 1 goal and getting them to do that, that's an amazing feat of accomplishment for that child, and then move on, then add another one after that. So the what the parent may be putting on their refrigerator to remind them of what to do, it doesn't look overwhelming to them where they just like, I can't do this, it's too much. Okay. So it keeps it small. It's not that IFSP packet that's like 30 pages long and has all this writing in it. This is just broken out just for them. Again, in the beginning, starting out with a couple of outcomes or priorities and routines should be a good start and not overwhelm them. Because again, if they're overwhelmed, they're not going to do it. They're just not going to do it. Over time, outcomes and priorities, daily routines and strategies will change, and they should, as a child is growing and progressing, because it shows that there is some growth and that there is fidelity of implementation, meaning the parent or the guardian or whoever is implementing these strategies and these interventions is actually doing it if you're able to see that the child is improving. So then when you do your reporting, your child outcomes reporting to the state, which then goes up to the federal government for funding, you have something here to basically back up what you're saying. It's really important, and I think it just makes the whole process easier. Okay, so we're going to create a matrix. So we, looking back at a couple of slides, remembering what the matrix looked like, is basically a table. We're gonna read a case study about Jay. And then as we read, let's make note of any parent concerns or priorities and routines. And then we'll create a matrix together. Okay. So I'm gonna, since there's only 1, 2, 3, 4, 5, 6 of us, maybe. That's what it looks like, right? I think. Okay. So since there's only 6 of us, I mean, we can just have like a discussion about it versus me breaking you guys up into 3 different groups. Okay. I think that might be more fun since it's a smaller group. If it was a bunch of us, then yeah, we'd break up. But since it's a small group, I think we can do this together. But what we're going to do is we're going to use, I don't know if you've ever used Padlet before. And we can use Padlet, or I can type into the actual matrix box itself. So we'll see what works best for us. But I'm going to go to Padlet so you can see what I'm talking about. The way it's set up based on the case study, like we would have the family's priorities and concerns, and then we would each go in and add our own during playtime, like what we would put to help with communicating wants and needs. So that might be better. That way, that would allow you guys to go in and put your own in there as well. So let's see how it all works out, and then we'll go from there. So I'm gonna pull up. Oops. Well, there's the table. Oh, there it is. I thought I pulled it up before. Okay. And I think you should have a copy of this case study as well. But since again, it's just the 6 of us, we'll go through it. It's not a very long case study. Sorry, blacked out for a minute there. So give you some background information. Jay is approximately 30 months old. So 6 months from his 3rd birthday. He has a twin brother and older sister. He was born with ROP. He has no vision in his right eye and limited vision in his left eye. This fall, he will start attending a program 2 days a week to prepare him for school. For family outcomes and daily routines, the family has identified the following outcomes for their child. So these are the things that are going to go on that left-hand column, right? They want Jay to communicate his wants and needs using simple phrases. They want him to begin problem-solving situations independently. And they want Jay to demonstrate an understanding of positional terms, such as left, right, up, and down. Now remember, this child's not even 3 yet. So let's, up and down might be doable. Left and right, my mother-in-law's in her 70s and she can't get left and right correct. Save her life. So, you know, and for orientation mobility purposes, that's important. And I'm not saying to not use those words when you are talking to the child about that's on your left or that's on your right, because we want to encourage and we want to support the use of orientation words. And hopefully that will help them when it comes to orientation and mobility, if they need it, that they need to go left or they need to go right, and they understand which ways those are. Okay. My mother-in-law, her replacement is it on your side or my side? That's her left and right. So we definitely want our kids to do better. And then the routines that the family has identified is playtime, mealtime, and bedtime. And so let me see if, yep. So they have playtime, mealtime, and bedtime. And then here we would put our priorities and concerns. So you can see how the Padlet had the same area here with their priorities and concerns. And then we could go in and each of us put our own playtime strategy or mealtime strategy or bedtime strategy. So, and so let's look at his the strategy, strengths, and need adaptation. I'm looking at the time too. We have until 4:30, so let me make sure that.
That's 5:30 our time, in case people are confused.
I'm sorry, it's my, yeah, I'm sorry. I'm an hour behind you guys. I'm in Central Time. Yes, thank you, Lisa. I'm gonna freak people out here. So I'll read this and you guys can follow along and just kind of make note of, let's see. We have what his wants and needs are. So we already know these things here. So keep track of what the behaviors are and what he's showing, and maybe we'll think of some strategies. And I have some examples for us to use as well, okay? So Jay was previously evaluated by a speech and language pathologist as there were concerns regarding his expressive and receptive language. However, he is not receiving speech services at this time. Jay identifies familiar people by name, such as his mom, dad, and siblings. He requests familiar items and will repeat simple words or phrases. Jay understands directions, such as put away your toy. If Jay becomes frustrated, he will often cry rather than communicate his needs using words or gestures. He has also started to demonstrate some behaviors that the family thinks might be associated with his lack of communication. Jay's mother expressed concerns regarding his problem-solving skills. For example, if something gets caught on the wheel of the baby stroller he's playing with, Jay will become upset or cry rather than try to get it off himself. His family's trying to help him problem solve through these situations. He will also often try to take a toy away from his siblings or cry when they take a toy away from him. Crying to gain attention when something happens is a very early stage of developing problem-solving skills, according to Dr. Farrell in 2011 from one of her books. Parents can help children move beyond this stage by teaching them to use words or gestures to communicate their wants and needs. Additional strategies that can be used to develop problem-solving skills include learning the relationship between cause and effect and providing them with opportunities to make decisions or choices. Currently, Jay is walking. He's able to jump in place and enjoys jumping on the small trampoline in his living room. He's able to climb up the stairs on his plastic slide. Jay is able to navigate around his house and other familiar environments. His family has placed blue contrasting tape on the doorways of their home, as well as some furniture pieces like the dining room table. Jay will be receiving a cane from the developmental therapist orientation and mobility later this week and would benefit from developing an understanding of positional concepts to aid in navigating his environment. Okay. That's not the document. I'm trying to open this other document that has. Okay, so we have the table here. I'm trying to see what I did with real quickly. Nope. I thought I had this separate. So, oh God, it's already 5 after. Okay, because I want to leave time for questions. I wanted us to do this together as a group, but I don't know if that's going to work out because of the time. So what I'm going to do is I'll just show you basically the outcome. I apologize for the time crunch here. So communicating his wants and needs using simple phrases. During mealtime, one of the things that we could encourage him to do would be to encourage Jay to request more during mealtime, and allowing him to make choices on what he wants to eat for mealtime. So communicating those wants and needs using simple phrases, instead of him pointing at something that he wants, we could or actually, this is for requesting more. If he doesn't have the verbal words to say more, we can teach him baby signs. I use that with my daughter, and it's not formal sign language, but more would be the sign for a child so that he's either using his words or his signs to communicate with you. So we would encourage him, instead of going or crying because they want more, to say, oh, you want more? You want more, as you're saying the word more, and encouraging the child to do that. For allowing them to make choices on what, hold on a second, what he wants to eat for mealtime, giving just giving them a choice of 2 things. If you're going to be, I would be real careful about the choices that you're giving him about for what to eat. I don't think you want to give him a choice of broccoli and a choice of like something more savory that he might like to eat, Cheerios or pasta. If you want the child to choose to eat vegetables, giving them a choice of 2 different vegetables might be a good way. And having the child point to it. And then as the child points to it, oh, you want the broccoli? Or, oh, you want the corn? You want, so that you are encouraging the child to communicate those wants and needs by using their words, and say, oh, you want the corn? And if he says yes, oh, okay, well, say, I want the corn, that kind of thing. So that you're encouraging the child using those phrases, using the words, instead of pointing or just using gestures. I don't know the sign for corn and I don't know the sign for broccoli. So if you have a child who is a sign language user, or even I was going to say Dynabox, but that's the word I know for it, but a choice board or something that has the pictures or the tactile symbols for the two things that you're giving them a choice. If they can't use words, they can communicate nonverbally using any of the tools or assistive technology that maybe the speech therapist is working on with the child. And that's the other important thing too. If the child is um, using assistive technology tools, planning this family matrix would also be very helpful to involve your OT and your speech therapist when this planning is going on, or at least sharing it with the occupational therapist or speech therapist, so that you are all working on the same goals that the family has set up. And if you're going to be coaching the parent to work through this communicating wants and needs using these simple phrases during mealtime, the occupational therapist and the speech therapist can then also use or work on this same goal during mealtime while implementing the either the assistive tech that they may be using, or the sign language that the speech therapist might be teaching the student, or if the student has a deaf hard of hearing early interventionist, that person, if they're deaf blind, they're probably going to have both the TVI and a DHH. At least in my experience, that's how it was. There's not, right now, we don't have, I mean, very many certified teachers of students with deaf blindness. That would be amazing if we ever can get that going. But because it's so low incidence, it's really hard to do that. I think the University of Utah has a program for that, that where they are actually putting out teachers of students with deaf blindness. However, until then, what's been typical in my experience is for the child to have a TBI and a DHH. So when we're working on this family matrix, it is extremely important to make sure that everybody's on the same page with the goals that the parents want, and when they're going to be encouraging the use of those strategies to help that child meet that goal during mealtime or during bedtime. Okay, so so this is just one way we can help the child using those two of the three routines that they're going through every day during mealtime and bedtime, to help encourage communicating wants and needs using simple phrases. So it takes you as the early intervention provider interviewing, observing, talking to the parent, and figuring out what's going to work best, and then using your experience, using strategies that we can come up with to help when we're working with kids trying to get them to communicate, and sitting down and doing that, putting this on this matrix, so that this, you can easily see this kind of being on the refrigerator. At least I know I can, and I've seen it working with families when they're using the matrix, when you're using it with the family. So I want to point out real quickly, and then I'll stop so that we have 15 minutes for questions. Demonstrating an understanding of positional terms, because remember, these kids, some of them might need orientation mobility someday, and not only mobility, in general, it's always good to use the positional terms. You know, up, on top of, behind, underneath, inside, outside, right and left, regardless. So how would you do that during playtime? Well, you can play Simon Says, which is awesome, or some other kind of similar game where you would have directions like, shake your right hand. Simon Says, shake your right hand, or the hokey pokey, those kind of things that kids, sorry, my cat's wanting to be the star of the show right now. I'm going to have to put her down because she's going to step on my keyboard and that'll send my computer awry. I mean, that's a simple strategy to use. It's something that can be done every day. It's something that can be done with other siblings, that the parent doesn't always have to do it with the child, right? With other siblings or with other relatives or anything like that. So that's why it's so important to have this, coach them through it, and let them know that it doesn't just have to be them. During mealtime, putting objects out of reach, or have him retrieve items while you're cooking. like using positional terms like the towel is in the bottom drawer. The towel is over the cabinet door. Those are hand me the spoon that's in front of you. Hand me the fork that's to your right. Those types. So you could easily do that during meal preparation time, or when you're sitting at the table ready to eat, you know, maybe having the child help set their own place. You know, put your spoon down on the right side of the bowl, put your fork down on the left side. I mean, you know, there are different ways you can do that. And again, this is something that can be done any mealtime, and it can also be done by other family members or siblings. So the parent doesn't always feel overwhelmed to be the responsible one to do it. And then of course, bedtime, when getting dressed for bed, use positional terms like put the shirt over your head, put your right leg in, put your left leg in, that kind of thing. Put your right sock on, put your left sock on, especially if you've got kids who, I sleep with socks because my feet are always cold. You may have kids who need to do the same thing. So you can see how just using this matrix can bring all of that information that we're throwing at parents during an IFSP down into a simple table that they can just pull out, put on the refrigerator, or have it wherever it is that they, you know, maybe next to their calendar, where they can get it and not have to worry about pulling out the IFSP packet of documents, because that can be really overwhelming for the families. Okay. I'm sorry I had to rush through that. I really wanted us to do it as an exercise, but I didn't want to run out of time. I wanted to give you guys time to ask questions. But you have the information, you have the PowerPoint, you have the links to the sites. And so I hope this helped you. And I hope, let me make sure that you will have, that you have access that I put in the resources. Hold on a second. Yeah. So the references back here have the article that was written where the matrix came from. And then other information, other links to daily routines matrix from the American Printing House for the Blind, and other good information. I think one of the things that we found, or that Ely and her, the other researchers found, that the early intervention providers using the matrix found that there was increased parental engagement, which is what we want as early intervention providers. We want more family engagement. And, you know, because we want them to feel comfortable working with their child. And then of course, it guides EI providers in implementing family-centered practices, using those priorities as a guide to that collaborative and coaching partnership between the EI provider and the family. And of course, the other team members who are so important to the overall service of the child and getting that child to progress. So I will open it up to questions now. Sorry, I had to rush through it, but I hope you found it useful.
I haven't seen any questions in the chat box.
Oh, okay.
And they're very quiet. Feel free to open up your mic and comment.
Yeah, exactly. It doesn't have to be in the chat box.
Yeah. Could you show us a sample of the routine-based interview document?
Yep, I'm going to open this up. Okay. So, let me make this a little bit bigger so you can see it. Oh, maybe, there we go. Okay, so this was developed at the Vanderbilt Center for Child Development, which they have an awesome center there just doing a lot of research. But here, this form, it's the routines-based interview report form. The directions are here. And you know what? I'm gonna put this, I'm gonna copy and paste the link into the chat, into the chat box. So you have it, okay? Oh, I guess I could have put the name. Do it again. There you go. That way, you know, you can get to this exact document because it has all the directions here. It even tells you, you know, for each routine, write a short phrase defining the routine, descriptions about the child. You know, if the interview revealed no information about one of three domains, circle no information. I mean, it gives you, I mean, it really walks you through. And you can go down through all of this stuff. Information about, obviously, what are your main concerns, you know, any engagement, any routines, any outcomes, and like you can even put priority numbers on the side. Waking up, could you describe what wake up time is like? Who usually wakes up first? Where do you sleep? I mean, you see how it really walks you through. It's a lot of questions, so you're going to get a lot of information. That and it's like it will become like a conversation. It'll get to the point where you may not be asking question by question. It may be that you are just taking notes, and as you're taking notes, you are actually getting answers to those questions without it looking like you are interviewing, which eventually you'll get to that level of comfort and knowledge of using a routines-based interview like that. But in the beginning, it may be more almost like robotic. You're asking questions, you're getting the answer. But as you get to know the RBI, you'll get to know the types of questions that are going to be asked. And as you're having a conversation, you're going to get a lot of the answers without having to actually ask the questions. Oh, good. Oh, thanks, Leslie. I'm glad that this that you feel the same way, that it kind of breaks everything down when these parents are right now, especially, are so overwhelmed. Like there's just so much coming in. They have the kids at home, all of their kids at home, probably in a lot of ways. You know, having to try to homeschool them. And then you've got a child with special needs or visual impairment or deaf blindness, and their TVI is trying to either Zoom with you or FaceTime with you. I mean, there's just, it's really overwhelming, but having something like that little chart, I think really just kind of cuts out all the noise and just puts it where where parents won't feel like, you know what, this is just one more thing that I have to do. Because it's not, it's just part of what they're already doing. We're just trying to structure that a little bit more, you know? So so everybody should have the link for this, but you can see it even goes down diapering and dressing, feeding and meals. You can see all getting ready to go or traveling, hanging out and watching TV, bath time, nap time, bedtime, going to the grocery store, outdoors. So you can see how these routines are, or like the at least the time of day whenever these routines are happening are already kind of listed out to help you guide the families into, these are things that are real common that happen in your house, you know, every day. Some families may have some different things that happen during the day as far as like in their daily routine, but everybody has to go to the grocery store. Everybody takes naps and have a bedtime. Everybody has a bath time, or at least they should. You know, everybody is, there's recreation and leisure time. So this helps a lot as well with building the routine section of the matrix for you. And for the families, again, sometimes they don't think of their days as broken up into routines. That may, you might ask them, well, what routines do you go through during the day? And you might have like this blank stare, like, what do you mean? So giving them examples and saying, well, you know, during bath time, what do you do? Because that's considered a routine. During lunchtime or when you feed the kids, what do you do? So that also helps get them the lingo that we use in early intervention. I think the other, where was it? Let me see something. This one here, pull that up. Oh, great. I have to let them know. Now that I work at APH, I can just shoot an email and say, hey, this link is not working right now. What's going on with that? Let me see if I can. Because I want to show you that the curriculum for the parents of kiddos with visual impairments, the PAIVI. Oh, well, now it's taking us to CBI. It's not going where I want it to go. Hold on a second. Parents and their infants with visual impairments. So there's this this curriculum guide that also it helps you help the parents with early intervention strategies and how to get the box for satisfaction with the routine. That is how the parent feels. Oh, yes, yes, that's what that is. Yes, Yvonne, thank you. Sorry, I stopped mid-thought because I saw that. Yes, looking at how does the parent feel about that routine and whether or not the strategy that you are working with, you know, trying to help implement to help that parent reach that goal for that particular routine. Yes, that's where they would answer. If they're not satisfied with it, then we need to look at a different way or different strategy to use for that. Okay, but this also is real helpful. Again, it's an updated version of the one that we had before. And it's, again, here it says here, it's designed to help parents and teachers of infants who are visually impaired become involved as primary members of the intervention team. And this was created as a 3-year project of the Blind Babies Foundation with support of USAID. So it's a grant funded project. And, you know, we have it. The parents who, and the EI providers who I know have used it really like it. And I'm not sure if, let me see, is it, I'm not sure if it's a quota funded material or not. So that's something you can always call in and ask, but it looks like we have 28 in stock. You can always ask your EOT and see if they may have one already in their area, wherever your EOT is housed. So there's that. I think the, I want to go back to this real quick. So you've got the RBI report. There was a book. There's also a whole book if you want the book for it with the routines-based interview. I mean, on here, there's a fillable one. So there's all kinds of really cute, neat things that you can get. But the link that I gave you, you can just download that and print it, and you would have to handwrite on it. Or you can make it a fillable PDF if you have the Adobe, that Adobe version that'll translate a PDF into a Word document. There's also training too, that I think even on YouTube, you can get to training with RBI. They're like 2 or 3 day trainings, 6-hour trainings, because it can get pretty in depth when you're getting training on RBI. But if you have that document, that should get you going, at least for now. Any other questions or comments, concerns?
There was another person, she already has left us, but she also had a comment to me that it fit nicely with, she works with a lot of children who are deaf. And the idea of learning another language, what you were talking about, she thought fit nicely with that kind of stuff. So.
Oh, yeah. Yeah, it's just open, you know, I like, yeah.
And I want to thank everybody for coming today. Thanks, guys. I want to thank you, Alaya, for being with us.
Yeah, everybody stay safe.